Hello everyone, welcome to Raaonline. I am Dr. Abhinaya. I am a consultant pediatrician. So in the chapter on infectious diseases, we are going to discuss on dengue fever. So in the discussion of dengue fever, I have divided into two presentations. So one will be the general pathophysiology and how do you classify dengue fever, and this is completely, the part 1 is completely based on the textbook discussion. The part 2 is based on our national guidelines on how do you manage dengue. So do check out both these presentations. Okay. So let's start with the introduction. So we're all familiar with the dengue fever, the types, or how do we classify dengue fever as. One is the dengue fever, second is the more severe dengue hemorrhagic fever, and the most severe presentation of dengue, which is the dengue shock syndrome. So the first, that is the dengue fever, is basically a benign syndrome. So it is a short duration illness, basically a duration of 2 to 7 days, with some of the common clinical features like headache, myalgia, arthralgia, retroorbital pain, general tiredness or fatigability, and these are the common rash, and some mild bleeding could be there. But most of these illnesses which are very benign, which are treatable in our outpatient basis, are classified under dengue fever. So dengue hemorrhagic fever means the more severe ones where there are overt bleeding manifestations, and there is of course the main pathophysiology behind dengue hemorrhagic fever will be the capillary endotheliopathy. So there is endothelial abnormalities in dengue hemorrhagic fever, whereas in dengue shock syndrome, patients manifest as either a overt shock where there is hypotension, or there is a compensated shock where the pulse pressure is very narrow. Okay, so this is just the introduction. We'll move forward. So the WHO in 2009, they came up with the term severe dengue. So severe dengue means it can involve any of these. So if the child has dengue and has shock, it is again labeled as severe dengue. Dengue fever with respiratory distress, dengue fever with liver damage. When you do the liver function test, if the AST and ALT is more than 1000 units per liter, it is severe dengue. Severe bleeding or altered consciousness or any significant heart abnormalities, any of these criteria is fulfilled, it means there is a severe dengue. So the dengue virus, we know it belongs to the flavivirus family, and there are 4 serotypes, isn't it? Dengue 1, 2, 3 and 4. So if a patient gets affected with the dengue 1 serotype, for example, he has immunity only to that particular serotype. So he doesn't have the cross immunity. Although it is hypothesized that there is some amount of cross immunity with other serotypes, it is not long lived or it is not lifelong. There is a very short lived immunity. So there are people who come every year with a dengue infection. So some 2 or 3 episodes of dengue could have been there in one particular individual. And we have some other illnesses which mimic kind of a dengue fever like syndrome. One is, we are all familiar with the virus, which is the chikungunya virus, which is native to our country. And chikungunya also has a seasonal predilection similar to that of dengue, and it is also spread through the vector Aedes aegypti, right? And apart from Aedes aegypti, for the transmission of chikungunya, the other vectors will be Aedes africanus, Aedes albopictus. And chikungunya has a very similar illness to dengue, and the distribution of chikungunya is not just in India, but it also extends to Southeast Asia, Africa, even in United States. Other viruses or other viral illnesses that will mimic dengue are, one is O-nyong-nyong viral illness, which is seen in East Africa, not in India. The other one, West Nile fever. West Nile fever is seen in India as well, and it typically mimics dengue illness. The vector of West Nile fever will be Culex mosquitoes, not the Aedes ones. And the vector of O-nyong-nyong is the Anopheles mosquitoes, not the Aedes. Okay. So these are all the arthropod-borne viral illnesses which are a similar dengue fever syndromes with